Strength Warehouse presents Go Heavy or Go Home podcast. I am your host, Nate Boley. In this podcast, we talk about strength, fitness, nutrition, and all things Strength Warehouse related. Hey guys, welcome back to the podcast. Super excited to bring you this episode. This is a topic that I love talking about, and I brought on an awesome guest to help us kind of go through it and decipher all the literature and the stuff out there in the internets. But yeah, we're talking about injury prevention, injury mitigation, and then how do you get back and progress into the gym once you've had an injury. This is something that I love talking about, and I geek out about it all the time. As our guest knows here, whenever I go and see them, we chat about it quite a bit. But Doctor Jordan Pangerl is our guest today, and we're just super excited to kind of go through this and help you guys through any injury that you're going to encounter in life, and how to decide if it's something that you should push through, go get help and seek advice for, and then how to get you back in the gym once some kind of injury does inevitably happen. But anyway, let's get into the podcast. You guys take a seat, kick back, grab a drink, let's go. So anyway, this episode, really excited to kind of dig into injury prevention and all the stuff that encompasses that. But I'm just going to turn over the mic and let Jordan introduce himself. So, hey, Jordan, welcome to the podcast, man.
Thank you, Nate, for having me here. And it's definitely a pleasure to kind of help everybody kind of understand a little bit more about the injury prevention, because that's definitely a passion for mine. So I grew up in Minnesota. I was really involved around the athletic realm of everything. So grew up playing hockey, football, soccer, track and field. So kind of as I got older, I started playing a lot more hockey and track and field, and inevitably it was something that I had an injury when I was running track and field. Some people told me on my track team to get into chiropractor and trying to have them help me out, and just within a couple visits it got me back to running 100%. So I just started chasing down that rabbit hole of how that kind of profession had helped me get back to what I really enjoyed in running, and from there I just kind of continually gained more knowledge about the profession and knew I wanted to get into it, and moved out to Portland about 7 years ago and did my career out there with a chiropractic program. And I really just indulged into a lot of seminars that really talked about injury preventions, how to approach those types of injuries, just so I can be most knowledgeable to help serve that community, because I felt like that was my best calling within chiropractic profession. So here I am now working with injuries, and a lot of my specialty is actually with car accidents, work injuries, but also with traumatic injuries from whether it's any recreational sport, weightlifting, or if you're involved in any sport activity as well.
Yeah, absolutely, man. So it got you. You got into chiropractic because you found like the magic bullet that fixed you, and then you found a passion for it, right?
Yep, that's exactly it.
That's awesome. What was your injury?
So it was really just kind of like a misalignment. As a short sprinter, you're coming out of the blocks from a low angle, and just the power that I was having was based off of one side more than it being equally distributed.
Sure.
So I was just kind of out of alignment, more towards my hips, and when I went in there, we focused more on my lower back and hip area, and from that, just a couple visits, like I said, I was back to 100%, not feeling any of the pain or discomfort.
That's cool.
It was great.
Yeah, that's so cool when you're just like, because being injury or having an injury and being an athlete, like, it's super frustrating, right? Because you cannot do what you put your identity in, right?
Yeah.
I'm a power lifter. I can't power lift. Then everything else sucks, right?
Yeah, and you're frustrated and you can't get back and doing any of it.
Yeah. So you started out in hockey. What got you to track?
To be honest, it was some of my friends, and then my sister as well. My sister's a little bit older than I am, and she was in track and field, and she was crushing it. So I was just like, I can't let her be the only one with the claim of fame.
Right.
So that got me into it with some other friends that also were short sprinters, and it was something that I just ended up falling in love with it.
Cool. Was your sister a short sprinter too?
Yep, that she was. Nice. And I'd say she was more decorative than I was, so I'll give her that.
Cool. What happened with your hockey career? Just put it by the wayside? Yeah,
so that was actually my kind of true love when it came to sports, but when I ended up going to my undergraduate, they just didn't have the hockey team there.
Yeah.
So I figured I was going to do a league, but my sister, like I mentioned, she was still running collegiately in track, so that kind of pushed me to join this team that I went to the school there, and funny enough, we were in the same conference, so we got to see each other quite a bit and kind of push each other in our own goals.
That's cool. Did you know that there's a hockey team here?
I did know that, and I'm actually looking forward to trying to get onto the team and like playing around.
Okay.
But I missed the registration last year, so I was a little bummed. So this upcoming year,
I've been trying to infiltrate those guys for a long time because they just work just a block away from here. And I'm like, none of those guys are doing any strength training. And I was like, you guys got to get in. But I get it. Sports, you just have to dive in. And a lot of times people just forget that there's other things out there. And they just go all into the sport, right?
Yeah.
All right, man. So the main focus of this podcast and talking to you today is talking about injuries, injury prevention. What do you do when you get injured and how to progress back into the gym after you've been healed, right? So let's start with injury prevention. This is such a huge topic. But as an athlete and a chiro / PT, what are your thoughts on this? Like, how do we thwart off injuries?
Yeah.
Or not have them in the first place?
Yeah, I think what it really boils down to is really focusing on your fundamentals. When it comes to whatever activity you're doing, I think the main principle is your core stability. That's your foundation. And I think a lot of coaches nowadays may kind of lack and underplay that. But I think it's more of a trend where it is coming back. But I think if you really focus on that, it actually helps with our body mechanics when it comes to the upper extremities, the lower extremities. Okay. So all of that can really hone in to actually helping you function better, whether it's with strength, endurance, coordination. So all of that is really just honing in on the core stability, and that's, I think...
So you're talking about just like your actual ab core area, like making hips and all that type of stuff, just making sure that's super strong?
Yeah, so when it comes to the core, it's really like your front abdominal region, the obliques on the sides, and even your lower back, like honing in on all of that and really building the strength, endurance, and having it in a good position with whatever activity you're doing. I think that can really help prevent injuries.
Sure.
And then obviously from there, just making sure you're moving in a good pattern for your body.
Sure. And when you say like strengthening the core, what kind of exercises would you recommend? Because I was in a debate the other day, and I won't name any names, with a coach here in town. Mm-hmm. We were talking about weighted core exercises, and some of the core exercises that this person was talking about, I was like, no, just no. So
no, this is a great question, because most people think like they want to get the cut, they want to be shredded, they want the six pack, or just being toned. It's summer out. Everybody wants that. Don't get me wrong.
Sure.
But I mean, look at it this way: the core for functional movements is really based off of doing planks or carries with kettlebells.
Yep.
Those are huge lifts that also can get you in shape, but also really works on true functional movements with building that coordination of your core.
Yeah. So, and I was my argument was, in order to understand how to strengthen the core, we have to understand what it's doing, what its purpose is. And the purpose is to make sure that your spine is aligned, right? And it's not like, so this person was like, I'm going to do weighted crunches and some other things. And I was like, that's not what you want to do. Like, you want to make sure that it's working in its capacity, right?
Yeah.
And just like strengthening that. It's like a big tower. If you think of a tower, it's got these, big cables that in certain areas that hold it in place, and if you knock one of them out, the whole thing is going to fall over or be out of alignment. And so we have to make sure that's what our core is. We're trying to work it in the way that it's supposed to be worked.
Yeah, exactly. And I mean, as you being a coach, I mean, you understand there's 3 planes of motion. So those functional exercises for your core with the carries and planks, like, you can work on all those 3 planes, and that's what you're saying. You're building that kind of anchoring points in all of those when you're doing these other exercises 100%. Versus just the traditional, here's some weighted planks, or not weighted planks, sorry, weighted
crunches,
like biceps and stuff like that.
Yeah, I mean, they're definitely going to like contract the muscle, but it's not working it in its true, way it's supposed to work. And purpose.
Exactly.
Yeah, absolutely. And so when you're thinking about that, what kind of would you implement like a specific day for this, or just in your typical workout?
I'll be honest, I think you should be doing those functional exercises with the core every day that you're doing anything.
Yeah.
You can be using it for a warm-up. You can be finishing your exercise with that, or even if you're just going out for, say, like a bike ride, you should be doing some of these stuff, because it really helps in tune or get your body aware of those muscles to use when you're doing those activities, and that can help prevent those injuries we're talking about.
Yeah, that makes a lot of sense. All right. What about like anything else, like shoulder, knee, ankle? What type of stuff?
For prevention?
Yeah.
Is that where yeah. So I think when it comes to those areas, still a lot of it's focused on the core. If you really work on that being stable, that can help actually, again, with the rest of your body moving the way that it should be, or optimizing it in a position so that it can use the proper muscles for those movements. But even within those, I think that you have to kind of take the person as an individual and how they're designed and how they may function a little bit better, or what their purpose is with those movements.
Sure.
And if you take all that into factor, I think then you can play around with it. So when it comes to those areas, obviously you can be doing specific exercises to help injury prevention as well.
Sure.
And I think a lot of those is going to be unique exercises that most people may not realize, and they just think it's all these glorified lifts, whether it's like shoulder presses or squatting, trying to bulletproof the knee, stuff like that.
Don't be dogging on my squats.
Well, I can't lift anything near you. So.
Yeah, well, that's true. It's taken a long time, and you don't obviously focus on max lifting. So if you did, there's a very good chance that you probably could. All right, yeah, that sounds definitely like the right way to go about it, right? Just take it as an individual approach. And we at the gym here, we take everybody through what we call on-ramp, or some kind of like body analysis of like functional movement, and then like we can understand how they move, because they're going to be a little bit slightly different than you or me, through life and injuries and tightness and whatever, or just fear of being in that position, right? And then it's getting to know them a little bit better so we can help them progress without getting injured.
Yeah.
All right, so let's shift the focus a little bit. You're lifting, you're in the gym, you're having fun, and then all of a sudden something happens and you get injured. Now, it could be anything, right? Like, it's funny how you don't really realize how much you use your pinky finger until it's broken or it's injured or something like that, or your toe or your arm or whatever. But just to say, let's just say you got a knee injury. Right. Yeah. There's two types, right? There's an acute and chronic. What's your thoughts on this? Should you stop right away, go seek help, or tough it out, or kind of what's your protocol, or what would you tell somebody that calls you, I stepped off the curb and my knee hurts?
Yeah. No, this is an excellent question. I'm glad you bring it up. I think some athletes are a little bit more aware about their body, and they probably have had other experiences from prior injuries, whether it's acute, chronic, and they can kind of judge whether they can continue push through things or whether they should kind of back off.
Sure.
In my honest opinion, based off of scientific literature, one of the best things you can do is try to keep moving.
Yeah.
So you may not be able to keep moving the same weight or whether it's the same activity intensity, but you should try to maintain some sort of level of activity. Do some modifications for whatever it is that you can tolerate within what's going on. Again, whether it's acute or chronic. But I think overall you need to go in and seek an opinion from a medical expert.
Sure.
Have them really look at this for you. So then they can really give you a better idea whether it's something that you should be a little bit more cautious of, or what we can do to help you actually with that recovery. Because sometimes it may be something where you have a true injury of a tissue, and that may be something where it's like we need to modify stuff, start getting that healing properties, and we can do a lot more of that through the conservative means, whether it's chiropractic, massage, acupuncture, physical therapy, and finding that right approach with what's going on. More chronic in nature sometimes doesn't always have to mean it was from a prior injury that never resolved, but sometimes it can be imbalances from stability, a strength component, endurance, or sometimes even just mobility.
Yeah, mobility is huge, especially when I think when it comes to moving your body, like in a squat, bench, or deadlift, or overhead press, or something where you're going to be doing multiple movements, joint movements, compounding. Mobility plays such a huge factor.
Yeah, so I think going really back to it, I think it's really just try to keep moving, but definitely seek out opinion from a medical expert.
Yeah, I think that in my past, I did not do a lot of that, and it's put me into the positions I am today. But now I'm learning. I'm older. Something starts hurting, and if it doesn't go away in a couple days, you contact somebody and just have them take a look at it. It doesn't hurt to have somebody else give you another opinion and maybe give you some knowledge that you didn't know that existed.
Yeah, exactly. And I mean, if you're not happy with the opinion that you get, there's always another one that you can seek out.
Yeah,
so
absolutely.
Don't be discouraged if you get somewhere in and it's something where you didn't feel like it was addressed properly, or maybe they're telling you something you didn't want to hear. Because every provider's made differently, and they're going to be educating you differently when it comes to just what their background is. So
I remember I had a chiropractor told me I should never squat again. I left.
Never chuckle out. I'm like, oh yeah, watch this.
Never came back. I was like, sure, I'll sign up another. I'll be back next week. And I don't think that obviously there is some people that's a true thing that there's something going on, maybe in your spine or something that you're just not able to, or there's the risk of more damage is a lot more prevalent at this point.
Exactly.
But like, 25-year-old that doesn't have a ton of pain or doesn't have a ton of like, bad injuries, just had like some kind of, my knee, it's been going on for years and years and years. I wasn't 25, but, and they're just like, well, maybe you just don't squat anymore. And I was like, maybe I'd go find somebody else.
Yeah.
It doesn't sound like something I want to do. So yeah.
I truly think whether it's an acute or chronic thing, you should not be preventing yourself from something that you enjoy. I think there's always a way to approach.
Basic movement.
Yeah.
Because squatting is a basic movement we have to have.
Yeah.
Yeah, no, that makes a lot of sense. All right, so in that point, like I hear this all the time, like I've injured XYZ area, let's say just go for the knee because it's right there already, and I've got to stop exercising altogether. Like we get this constantly. What's your thoughts on that? Should you completely stop everything because you have one area of your body injured, or should you try to modify and work around it, or I don't know, just like what's your thoughts?
Yeah, I think in general you should just keep going, and you can make modifications to that area. Find things that you can tolerate, so change those exercises, maybe lower the resistance that you're using. Maybe don't go through a full range of motion if it's really exacerbating those symptoms. So I think you can modify, keep active, and I think that's really based off of the literature, like I mentioned. Like most literature is showing now, like the more you can stay active and moving, you can help those tissues heal quicker.
Sure.
And you build more strength and resiliency in that scar tissue within, if it's a true injury, or maybe just some extra wear and tear given with maybe you're not moving properly. You can always modify things.
Sure.
But yeah, I think you should never really completely avoid and stop things unless it's certain scenarios like a surgery. Obviously, if you have a surgery, you need to stop and take it slow for a little bit. But if you can work around in other areas depending on with what's going on, maybe you can maintain some sort of activity, just so you're not completely avoiding it. But generally, there's not many things I would say you want to rest completely.
Sure. The old, this still has some merit to it. Rice, rest.
Yeah.
What is it? Rest.
Rest, ice, compress, and elevate.
Yeah, so that's not something that they really...
They don't recommend it anymore.
Yeah, recommend it. That was big for years and years and years.
Yeah, I'm blanking on the guy's name that came up with that protocol, but he... earlier this year actually ended up trying to say that it's not something that they would recommend anymore.
Yeah, they want more of the movement and the warm, like in heat, stuff like that, keeping blood flow and that type of stuff.
Yep. Just get more circulation in there, and ice, it can numb the area, but really it's not showing as much benefit as it does heat nowadays, and just movement and trying to keep weight bearing on those areas.
For sure. Cool. So that's great. Okay, now we have started to heal, or we are healed, and we want to get back into doing what we were doing before. Like how does that work? Like, what would you recommend?
Yeah, being there, done that, and obviously helping my patients recover from injuries, I think you really want to try to slowly ease into everything. As eager as we may be, you want to get back into, this is where I was left off at before this injury. You want to ease into it. The reason being is because, again, you're still building some of that resiliency within those tissues to that activity you're exposing it to. So starting at lower, again, maybe volume, maybe intensity, resistance, whatever it may be. I usually encourage maybe about a week, maybe two, kind of maintain that same level, and then from there try to keep slowly incrementing it back to where you were at. But if you start too eagerly getting back into it, especially if you're not rehabbing it appropriately or taking care of it as you should, sometimes that just can allow for re-injury or further injury. So to try to prevent it as best as you can, just ease into it. As frustrating as it may be, you'll get back to it. I
know you're talking to me right now.
I'm not pointing fingers.
Not pointing fingers. Yeah, you are. I definitely, this is something that I've struggled with a lot. Like, I want to get right back into it as soon as possible, and then most of the time it ends up with just it hurting again. So I've been really working on that type of stuff. Oh, let's talk about the shockwave therapy a little bit. Can you give me a little bit of information on that? For listeners that don't know, I've been receiving some treatment from Jorden here on my knee, and we've been doing some shockwave therapy, and it's been quite magical, actually. Went from like not being able to do a body squat without any pain to like squatting like 400 pounds with very, very minimal pain considering what it was before. But I'm just going to let him talk about it a little bit more and kind of what the details are on it.
Yeah, so shockwave therapy is also known within sound wave therapy. It's using actual sound waves, and it treats a lot of different musculoskeletal conditions, whether it's more acute, chronic in nature. And what it does is really penetrate deeper than most other modalities do, say ultrasound, that also uses sound wave. But with shockwave, what's unique about it is the properties of it, of how it's allowing that wave to get to those injured tissues. It's allowing for get more nutrients to that. So it really helps the cells of those tissues become more active. That can help it repair itself. Nutrients from your blood flow, or just nutrients to like your nervous system. It helps them function better by getting the nutrients to them, so that can reduce the symptoms. If you have more inflammation, swelling in that area, that can also help it get reduced by just helping that drainage occur. And then lastly, it's going to help reduce those symptoms as a whole with all those properties that we just talked about. And a lot of research backed up on treating, again, multiple areas, whether it's the foot, ankle, the knees, shoulder, neck, back, you name it. It's really shown that it can help promote that healing and also reducing these symptoms, getting you back into activity, and that can be within just a handful of visits, just solely using that.
Absolutely. I remember my first visit, like just getting in and out of my truck was painful, and then after I saw you, I go step up on my truck, I'm like, wait, there's no pain. I'm just expecting it at this point, right?
Yeah.
And then it kind of dwindled off a little bit over time, and but yeah, then I've probably done at least 12, but my injury was years and years old. So
yeah, and it's always it's independent on one individual to the next. Like sometimes you can get within just a couple or the handful that they typically see based off of the research that they've backed up on that modality. But yeah, I think overall, I mean, it's a very safe procedure to do. There's not major contraindications to most, so it's really versatile when it comes to treating whether it's acute, chronic, or for any individual.
And it's non-invasive as well.
Exactly.
The studies I looked at, which I think maybe you sent me, but it seems like they're really targeting shoulder and the Achilles tendon.
Yeah. The backup on that really is based off of those two areas, and I think more so based off of the foot and ankle.
Sure.
One of the first things that they looked at was plantar fasciitis and Achilles tendinopathies. Mm-hmm. And like I said, everything that backed up on that was really shown within just a handful of visits.
Yeah.
Patients' pain scales were going down drastically. Their activities that they had intolerances with were just skyrocketing back into not having as much discomfort.
That's awesome.
So, I don't know if I mentioned it with you though, but when it comes to the shockwave, it's kind of similar to like the non-invasive way of the regenerative injections to a degree.
Which those are?
Which PRP and stem cell.
Okay, gotcha.
Those are the two types, and those are, again, injections that are really using your bodily substances, and it helps promote that healing, whether it's, again, an injury or something kind of wear and tear going on. It helps that healing and reduce the symptoms in that area.
When I tore, I've torn both my meniscuses. Left one, I did it at work. I went into the center, and I wanted to talk to him about PRP or whatever it is. And the guy there, he said there was really not great, like, results and reviews on doing it. He's like, you can do it, but it's a lot of money for not the best. And he's like, given what you had, like mine was really torn. He's like, it's probably not going to fix it. And that at that point we decided to do a cleanup surgery instead. I think that might have been a different scenario though.
Yeah, and it could depend on when this was happening as well. Because
I tore in 2019. But yeah, it was just, I had a discoid meniscus too, and it just, the center part of it just like ripped, and there was like too much, and they're like, at this point, with what you have going on, like, you could do it and it would help, but it's not gonna like heal it, because really what you need is to have that excess meniscus removed. And I was like, okay, well, that made like, a lot of sense to me. He's like, right now, you have like too much stuff in there, the bone doesn't want to move, or the joint doesn't want to move correctly.
Yeah.
So.
And that's the way I approach everything. Is I'm pretty straightforward, honest. I'm thorough with my assessments, so I can make sure that with what's going on, at least until we have imaging to confirm that suspicion. There's only going to be so much that we can do with conservative means.
100%.
And depending on with what that may be, it may be surgery or those more invasive inventions are going to give you the best prognostic outcome. But most people don't typically always want to alter that. They want to do something else before doing that.
Sure. And I did. I went and they had me on, which was crazy, like a ridiculous amount of ibuprofen for like a week, and then it did go down. Pain went down, obviously, and swelling went down. But as soon as I got back off of it, you could just feel it clicking, popping, locking, all sorts of stuff. And the guy was just like, "Look, Dr. Ballum, great guy.
Yeah, sounds like a dance move that you had going on there for a moment.
Yeah.
Pop and locking.
Yeah,
dropping.
pop, lock. Yeah, clicking. Yeah, I could do a little bit of that.
But yeah, no, I think the biggest thing when it comes to, again, the injury preventions and everything is really just focus on how your body moves, what's your purpose, and just pay attention to how your body feels.
Sure.
I think if you really just are tuned in with a little bit of pain, discomfort, don't be discouraged by it. Like, kind of keep moving, just modify some stuff, and then get looked at. Like, it's not going to hurt just to get an opinion and kind of get clear on with what's going on.
For sure. I just find it, like, especially when you're heavy weightlifting, like at the very top of a powerlifting peak where I'm going to be almost competing, like weird things start hurting. Like just my pec all of a sudden just starts hurting. I'm like, what the heck? It hasn't hurt forever. Or shoulder or whatever, elbow, wrist. And I think there's definitely something to being like, I'm going to just feel it out a little bit and see what happens. And it's probably just like irritated because I've been really I've been asking a lot of it. And then you come off and you do like a taper right before your comp, and then you do your competition and everything feels fine. Like, I think that's what came and saw you, because I went to go pull my very last deadlift, like half of what I should be pulling, and my back was killing me, right? And it was because it was probably a little tight, and then I was out of alignment for sure. So just having those, and I think, which I'm probably going to start doing from now on, is go getting alignment like the week before my max effort lifting, so I'm like, I know for a fact I'm in line, so you have the least amount of risk.
Otherwise you have these imbalances, you're pulling more on maybe one side, and that can just lead to that kind of potential injury.
Absolutely. Exactly. If you're switching over to one side because your hips are imbalanced or out of alignment, or your legs a little bit longer, you're pushing on one leg more than the other one, the body doesn't like that. It likes to be in homeostasis.
That it does. It wants to stay balanced, equilibrium, and everything like that. So keep it balanced between one side to the next. And that's a huge thing that I approach with my patients, is trying to stay balanced on both sides. So even though we may focus on one side for an injury, like we're still doing the same thing on the other side, even though they can do more weight.
Sure.
Because two, the other things I focus on kind of more fine tuned, smaller muscles that are really designed for stability. So we put the body in a better position, so then again, that is allowing for those primary movers to actually help optimize in that position, so then they can get more strength, more endurance, maybe more coordination.
That's awesome.
Based off of just doing the stability and mobility focus.
Sure. Well, I know your main focus is like accident care, but what's your thoughts on helping out athletes?
I love athletes. You're more than welcome to come in and see me by any means.
Cool.
But yeah, my focus is really based off of car crashes, because anybody that's ever been in it, it can sometimes kind of flip your life upside down.
Yeah, absolutely.
And just really helping them overcome those and get back to feeling better than they had before.
Sure.
Like, that's just really rewarding to me. So I take a lot of pride and joy in that.
For sure. I've actually been in 2 car accidents. I was in a rollover accident doing about 70 miles an hour, and then I was in a head-on collision right in front in Tumalo. Somebody fell asleep at the wheel and hit me head on. It was crazy. I didn't have any. Well, actually, I lied. I had the flip over. I had a seatbelt bruise, and I hit a fence. And the door caved in and hit my leg. And then the frontal crash one, I had the gnarliest seatbelt bruise, and then my hand had slipped off the steering wheel and like punched through the vent and just like cut my hand all the way to. Oh man, it was terrible. But that was it. They had to actually jaws the life of me out of the other one, because the door was crunched and the seatbelt was like all jammed up and the other door wouldn't open. It was pretty gnarly. But yeah, thank God I didn't get any serious injuries. But I think about it all the time still. So I can imagine if you've been into a really terrible, a car accident where you are seriously injured, I can, like you said, turn your whole life upside down in 1 second. So that's something where I just really like it, so I kind of focus on that. Cool. But I don't want to discourage any athletes as well coming in, because that's definitely something that I grew up and I just wanted to give back to that community as well. But it just happened to be when I was ending my program with chiropractic school that I wanted to at least be exposed to that kind of realm with personal injury. And when I got my foot in the door, I just knew instantly this was my calling. Cool.
So
that's awesome. Yeah, dude, and I've been sending people your way. I don't know if they've showed up or not, but I've been sending them your way.
Yeah.
So how would they get a hold of you? Find you, follow you?
Yeah, so the best way to contact us is our phone. It's 541-668-6320. Again, we're called Accident Care Chiropractic and Massage. It's over off of Highway 20, over near the Costco on the east side of town. It's in a parking spot next to the Whole Foods and Safeway on that east side. So by all means, if you're ever curious or need any help, whether it's just an opinion or maybe seeking more formal care, you can always just give a call or swing on by. We'll be there and we'll let you know what's going on.
Do you guys have a social media presence?
So yeah, we do have a little bit of a social media presence. I have one through Facebook. I'm working on an Instagram one, but if I want something that's more of a personal one, you can always just look up Doctor Jordan Pangerl. That's something that I usually will have stuff based off of my previous clinic that I was working up in Portland. Just got to work on more content here.
Yeah, absolutely. Right on, man. Well, this has been awesome. We should definitely follow up and do something else.
Yeah, absolutely.
It's super fun to have you on the podcast.
Thanks for joining us on this epic journey of strength. If you liked this episode, please leave us a review and share with a friend. To stay connected, hit that subscribe button. All right, until next time, go heavy or go home.